Awesome, everyone. I'm so excited to have with me Patricia Gaffin. She is entering her career in healthcare informatics, and she is going to help you get inspired, just like we were talking off camera, and she was getting me really inspired. We're going to talk to you all about what is healthcare informatics, the pros and cons, the requirements, and lots of awesome things and awesome changes. And you can totally do this if you're listening. So Patti, thank you so much for coming on to tell us about healthcare informatics.
Thank you for having me. I just want to first start off by saying I've received a lot of private messages, and I've been so busy between going to school full time and working full time that I really tried to get to you, and I apologize. I still will. I have not forgotten about you. So basically, just a quick little synopsis of how this started. I ended up being a therapist. And as I was telling you earlier, within the first year, I had a back injury. So that was in the back of my mind already as a precursor, like, planning wise, where is this going to take me down the road? And I have to have, the ergonomic skills to be able to be proficient in my job and produce the standards and the productivity that all these companies really want us to have. So I bounced around to different places. I did pediatrics, I did outpatient, inpatient, I did home care. I had my own business in Switzerland when I started up my own ergonomics business. I did that as well. And then I started doing home care, and I was driving around a lot, and it just hit me like, wow, there's got to be more. We as therapists have so much potential to give into the healthcare business and IT world. There's got to be something there. And I remember being on this site, and I kept seeing other people kind of talking about it. I didn't know what the definition was. I had no idea what health informatics was, and data analysis and data scientists, and I was really overwhelmed. So being a therapist, we like to research, evidence-based practice. We want the material. We want to know exactly what it entails. And can we do it? Like in your mind, is this possible to complete? And yeah, as therapists, we can do this. Our schooling has prepared us for anything. We sometimes underestimate our skills. So if you're out there and you're not really sure on the fence, hear me out. The program that I went through at USF, you have great mentors, you have great professors, everything's online, but you can do it at your own pace. And sometimes they have a schedule, but it's doable. Sometimes it's very difficult because you have to balance school and work and, family and events. And
that's a good question, Patti. So we're gonna go back to what is healthcare informatics in just a second for everyone listening. But were you doing your schooling while working full time still?
Yeah.
There you go, everyone. That's awesome. And that's really how I would recommend it too, is, it's so hard to transition if you are already in an established career. So that is awesome to know with this Career Act that there is an option to do this in the evenings and then work full time as well. So that is awesome.
Yep.
So really quickly, do you want to try to help everyone understand what is healthcare informatics?
Yes, I actually have some notes here just so I can be concise and really optimize the time that we have on here, because I know everyone's time is precious. So I basically wrote some notes here. If you would, I'm going to just use my notes.
Yeah, go for it.
So basically, healthcare informatics merges information technology and healthcare documentation. And basically, it goes through electronic medical records or electronic health record systems. That way, you're taking care of the patient and the organization, and also basically trying to manage within the value-based system. So a lot of trends right now are trying to save money. As you know, as therapists, we get crunch, do this. We got to do, 100 things within 5 minutes, and we're multitasking, and we're trying to really improve ourselves, but also help the organization, the patient, and next thing you know, it's burnout. And you just refuse to be a victim. And I use the victim word lightly, but that's how sometimes we feel. We feel like, what are we doing, and how are we utilizing our skills, and what are these outcomes? So basically health informatics gives you the opportunity to go into various areas. Some of the areas you can go into with healthcare informatics degree is being a data analyst. If you want to go into the analytical portion, there's actually two scenarios within my school. So I know some schools do it together, but you can go into the analytical side, or you can go into just the straight health clinical informatics. And that's the side I went into. I have 20 years of occupational therapy opportunities and consulting and classes, and I'm not the analytical portion. I know several nurses within the program that are the analytical portion, and they love math, they love statistics, and they love things that would require information for population health. And I'm just not a numbers cruncher. So I see processes. As therapists, we do activity analysis, we break down things, we see things, we use EMRs daily. So the fact that this relationship that therapists have with health informatics is a premium idea. So it would be a good transition. Like I mentioned, you could go into data analysis, you can work for Epic. Yeah, a lot of places that it pays very well. You could do the EMS Epic being within an ambulatory team. You can do hospital information system jobs, population health. You could be a project manager. I did a class on project management, healthcare project management, and it was absolutely something that everyone should take. Even if it's like an online class on LinkedIn that is very similar to what we do, and there could be entry positions where you could be a team member and learn on the job. I love that course, and it's a great area. I'm actually in quality control and quality improvement. That's also an area that you can go into. You can also be a chief compliance and privacy officer. That's about $137K. Clinical analytics informatics director, that's about $146K. Informatics workflow consultant, that's $103. Now these are averages that I've seen on various sites.
You hear that, everyone? Did you hear that? What?
Yeah.
What?
So there's opportunity out there.
Can I get like
productivity?
What's that emoji that's like, what? Everyone put in the what emoji.
Without there's standards. You have to meet metrics, just like you have to meet metrics in therapy and in every business. You have to meet metrics because you want to do the best that you can for the company. I mean, you always have to answer to the internal C-suite and to your patients. You want to do the best job. So there's a lot of opportunity. That's
awesome, because see, I really didn't know. I love choosing jobs and talking about jobs where you can get one skill set, but it can enable you to do like a lot. Yes. Woohoo, we got a heart. Thank you for that heart. Where we can do like a lot of different things. So that's really neat to know that with like a degree in healthcare informatics, I could do quality, or I could do data analyst, and
chief information officer
and all that. So that is really, really neat. So what inspired you to choose, I think you said quality, right?
Quality.
Versus some of those other ones.
To tell you the truth, you might hear my Staffordshire Bull Terrier chewing up a bone, so don't mind him. So I chose quality because honestly, when I was first job hunting, I was certified at USF. You take 4 classes, they call it a graduate certificate, and then you can enter your field. So it took a few months. I kept looking. I was getting discouraged, and I was panicking because a lot of positions said nurse, and a lot of the competencies that they were asking for were very much a unicorn. And I said, how am I going to learn all this? How am I ever going to get this? And I was panicking, and I almost left the program. But my mentor, she kept me on the track, and I questioned it for a long time. I said, oh my God, what am I doing? It's costing me time and money and my life. I'm putting my blood, gut, and tears into this. And next thing you know, I have 1 major class left. I have an elective and a project class. I graduate in December. I'm looking at the jobs now as my company is restructuring, and I'm looking back and I know this. So you'll get it, just like when you're a therapist, you're like, am I going to get it? But going back to the original story, not to get sidetracked, but quality, I couldn't find a lot of positions that I was ready for because of what they were asking for. They were looking for that unicorn I mentioned. And then I came across a company, and I went for 4 interviews and I got the position. So I could lie and say I love quality and I am OCD. I want things great. I put my name next to my assistant's work. You know, that's my name. It's my work. And but it fell in my lap, and then I realized how much I loved it. Everything about it. You're auditing, and you're auditing your assistant's charts, so you're checking their work. So it's something that we're doing. You're analyzing the data. You're sometimes working with more than one EMR system, where you're taking a look at like the blood pressure and the various diagnoses, and you're developing your plan of care. You're developing like a root cause analysis. You're figuring out what you need to do to make this happen and to help this patient. So it's almost the same thing like with quality. Like, what do you need to do to meet the basic things for the patient, the nurse who's putting the information in, whether it's a registered nurse, an LPN, or just a CNA, anybody that's working the floor, and the organization. You got to meet the 3 pillars. You want to have quality, you want to have safety, you want to have the ability to be efficient and engage the staff, the clinical staff, to be able to do what they need to do. So all that is what we do as therapists. And it was just a perfect mesh between quality and therapy. I mean,
I love that.
That's what we do.
We
breathe quality into our EMRs, our work.
Yeah. And that's so important, I think, because it gives you a level of confidence. I think it's something,
and
if you try to transition.
And we multitask.
Yes, exactly. It's our skill set. Like, you know, I think this is a career that sounds very similar to our personalities, very similar to our skills. And it sounds like you can bring a lot of what you've learned as a clinician into healthcare informatics, which makes you more confident and makes you more successful overall. Now, we were talking a little bit offline as to, you know, a lot of people are always like, well, I see nursing informatics, but you're saying that these positions, you are finding PT, OT speech. Are you finding any
It doesn't say PT, OT speech. Okay. That trend isn't out there yet. I did see it a couple times, and I said, okay, good. It's getting out there. You know, we're getting in the door. So, but a lot of it does ask for nursing or healthcare related degrees.
Gotcha.
Right. So they're opening the door. They're opening the door, which is good. I see like this trend happening. So they don't specifically say, you know, but I don't know. It's hopefully one day it'll happen, you know. Got to get the rest of the therapists to get in the program and push for it and be like the trailblazers. So, but it'll happen. They know what we're worth.
Yes. Now, do you think we have a lot of assistants, PT assistants and OT assistants?
Yeah.
Do you think that this is a route that they could do too, or would you recommend more PT, OT, and speech
Absolutely.
therapists? Okay.
In my program, I've come across various people. Like in the beginning of each course, you meet other people within the field. I've met physicians, primary care physicians that are getting out of the practice because they're burnt out. I've met engineers. I've met lab techs. I've met PTs, OTs, speech, CNAs. Honestly, anybody. Surgeons. I know there's surgeons there because pharmaceutical reps, pharmacists, because there's biotech industry or pharmaceutical, or you can go into the clinical research side of things. Also, there's so many avenues and so many disciplines and opportunities that you will find your niche. It's bound to happen because we fit the definition of informatics. We're on an EMR or EHR all day, you know, planning and actively listening and working in a stressful environment. Here's some key soft terms: multitasking, collaborating. These are things that you can, if you want to apply to the program, these are words that, you know, high key terms: self-directed, excellent organization, analytical, interpersonal problem solving skills, strong computer skills, planning, being reasonable, and knowledge of systems and how it coordinates with patient care, and understanding various standards per like JCO and accrediting bodies like CMS standards, insurance standards. We know all this stuff, and this is what informatics is. We have that underneath our belts, and we have to use that tool to be able to move forward. So sometimes you feel stagnant, and you just come home and cry. You're like, I spent so much money on school. I put my life into this, and look at me now. What is happening to this industry? It's happening.
Yeah,
it's happening. We're here. So the only thing constant in healthcare is change. So you got to see what's happening and be ahead of the curve. And if you're on the fence, you're not really sure what to do, just do like an analysis. I mean, we do analysis. Do your positive and negatives, and see where is your energy flowing. And I know sometimes you're down and you feel horrible and you're burnt out and you're like, I don't want to think about this. But take the time, get to know you, plan it out. You know how to do that. We've learned to do that, and reach those desired benchmarks in your life. I mean, if you feel like you're just dying inside and trying to meet standards for somebody else, go to school and maybe be your own consultant. You can do your own business nationwide. I know people that have worked for companies and local HIMSS chapters that have stepped out of organizations and have their own business. And all they do is they go to various organizations and teach their private offices how to optimize an EMR, looking at their workflow and processes. I mean, we have it down because we have to have. I know. I'm
like, Patti, wait, I already do that.
Yeah, you have to have like 200% now. Is that the average productivity? So you have to improve your system performance and how you get things done. And that's what I do now. So
now this is a fully remote, and this is a fully remote, everyone. This is a fully remote job, right? Or you said
my job I have now. The job I have now is on site. I supervise 44 buildings. So I go and I teach nurses how to utilize the EMR to optimize quality measures for the patient. So I teach them how to prep the chart and how to go through the process and how to do it in a effective manner, and having that ready. So when the patient does come in within the next 48 hours, that they have the information ready to go, and the labs that are required that need to be set or prepped before the patient comes. So there is a little bit of nursing stuff. Don't get freaked out, but you'll learn it on the job. You know, I was really nervous too when I started talking about that. I'm like, oh, I hope I don't scare somebody, but it's really reasonable. We learn, I mean, we can get it. I mean, sometimes we don't have the ability to see that, even though when we're in the storm and there's the lights, you know, you just like when you were going through therapy school, you keep going, you keep planning and keep, you know, do the vision board, see yourself being forward and, you know, doing something that you love.
Just take action.
Yeah.
Now for these jobs, are they all in person? I think we were talking, and some could be in person, some could be remote, some maybe like a hybrid.
Yep. So I was looking online because they're restructuring my company right now. So I'm on the fence on what's happening. I don't know all the details yet, but in the meantime, you know, us as therapists are always planning, making sure, because you want to put food on the table and, you know, important things like that, pay your mortgage. So things, honestly, I've been looking, and whatever you want.
It varies.
In-house, it's travel, it's remote. The opportunities are endless, and you don't have to necessarily even work in healthcare. You can work for like IBM. You can work for an insurance company. You can work for a doctor's office, you know, not necessarily treating patients, but just auditing reports. There's actually an area also that piqued my interest at one point. I took a class it was business intelligence. That's huge. It's a huge market, and everybody that has a business uses business intelligence, no matter who it is. An ice cream stand uses business intelligence, even though they don't think they are, they are. That's a huge field, you know? So I don't know. I just get really excited
No, it seems like it's so open that there's so much variety to it, which is really great. So we talked about what is healthcare informatics, talked a little bit about the fact that you can do the schooling on the side, that there's a variety of different career routes and companies that you could work for. We talked a little bit about like the day in the life and the pay rate. Now, why did you choose USF? I think some people may be like, oh, cool. Like, I'm stoked to try to get into healthcare informatics. What's sort of the next step once someone thinks that they're interested? Like, why did you choose USF to go to school?
So I was looking online for an online opportunity, and I did a lot of research on various schools. And this school really piqued my interest, just the classes that it had on there, feedback that I received. I consistently spoke with an advisor there, asking her questions, multiple hours and weeks before I made the decision, final decision to enter. They are a part of HIMSS, and HIMSS is a national health informatics corporate, hard to put it into words. It's an organization like AOTA. So basically, they basically are the milestone, you know, the things that we need to reach and the pinnacle of what we want to be able to do. And they have national orientation events, or like week-long events, which last year I was supposed to go, but because of COVID, they canceled it. So this year they're going to have it in August. I think it's August in Vegas. So I'm considering that because they said they flipped me with the payment. So I didn't pay, I paid last year, so they're pushing it forward. Now they're forcing me to go. God, I gotta go to Vegas. Oh God. So I got off track. I'm sorry, I've been up since 4 this morning. What was the question you were asking?
It was, why did you choose USF? I think you were talking about you compared different online schools.
Yes. So they were linked with HIMSS, and you get a student rate, and you can get onto the site and you can take a look at the job postings. You could take a look at the courses that they have. Otherwise, it's very expensive to be involved. And once you're in that group, you get to see the trends of what's happening, new fields, artificial intelligence. If you can actually come up with your own, like say like an Apple Watch. You know, they have certain things now that they have teams, companies that are built just for certain tools that people use in everyday life, whether it's healthcare or exercise based. So there's so much out there, and I never even knew until I took a look at the whole schedule. I was looking at like, wow, I didn't even know that existed. So it gives you an opportunity to think outside the box and recognize what is the need out there and where you could kind of fall into, even when you don't even know what you want to do in health informatics. It gives you an opportunity. But like I said, USF was just hands down, absolutely professional, and answered all my questions and spent hours upon hours. I mean, I know they want students to come in because I know everybody has a business to run, but they answered all my questions, all my what ifs, all my fears, all that was, you know.
I see they have, I'm on their website looking.
Okay.
So they have healthcare informatics and healthcare analytics.
Correct. Like I mentioned earlier, you can split. You take a certain core courses, and then you can decide where you want to go. So like I mentioned earlier, some of the nurses went into the analytics side. Some of them already have opportunities at work where they play around with the computer and they do population health and data analysis. And they have certain apps that they run, whether it's like SQL, SAS. And I did it, I enjoyed it, but I don't love it. And
gotcha.
I want to be passionate about my job. I've done 20 years of clinical, and that's what I'm familiar with. But sometimes people have an edge towards something else. So unless you know what you really want to do, you can split your path. I know there are some schools, they go straight down the middle and they give you everything. But that's part of the reason I didn't do that, because I don't want to do that. I can't sit at a computer and crunch numbers all day. That's not me. It's not I'm a people person. I want to look at process improvement, you know, and just keep moving forward and have that interaction within the clinical, but not necessarily, you know, treating patients, but helping the patient. to be
I'm the
able
worst
to
with math, so I think I would fail out of the analytics side.
Yeah, it's not fun for me.
Now,
So
now I see that they have a master's and a graduate certificate.
yeah.
So is the hiring potential, like, do you almost need the master's, or do you think you could get a position with just their certificate? What would you sort of
So
recommend?
it depends on your ambition. So I'll be honest with you, when I applied for the school, they prefer you apply for the master's program because they don't want you to apply just for a graduate certificate. They don't tell you that, but I got the impression that if you want to do informatics, you want to get into the program. I know some people that have taken the program. They stated they wanted to take it, and whether it's financial, emotional, just timing or health, they stopped the graduate certificate, and there's no worry. I ended up getting my job right after a graduate certificate.
Okay.
So I'm at a position now, I don't need to leave. I never had to continue. But I know that's not me because I want that upper level position.
Yeah.
I want to put the time and effort to have that 140, 150K job. And it's competitive. I know with therapy, they get rid of us. They'll be like, okay, next body. You don't want it, next body. You know what I mean? But in this field, you want to be able to offer more. And the more you offer, financially, it's more rewarding. So
I agree with that. I mean, how I figure a certificate is so I have a minor in economics, and I can tell you that my minor is pretty much worthless. Like, I wish they would have just told me in school, take 3 more classes to get the major, Emma.
Yeah. Well,
and I mean,
you never know what it is. So I'm glad you asked that, because like, if people are okay with it, it's perfect. Like, this is a great job. I love it. It's everything that I know, and I'm happy. But I'm always been like, oh, I need my master's in OT. I need my master's in health informatics. I'm just that personality. And
well, you've gone this far. Like, I think it's nice to have it, because it seems like it's a stepping stone. So it's like, well, you get this, and then you could take a break or just continue. And so it is nice to have that stepping stone where it's not like you're tied in for that. Now, can you talk a little bit about, do you know the length of the difference between the certificate and the master's?
So each class is 8 weeks long.
Okay.
And it's 4 classes.
Okay.
For certificate.
That's not bad.
So even if you start looking for jobs, like I found my job, which is the graduate certificate, you can go on LinkedIn and become Lean Sigma certified. You can get a certificate in, business models, or, take a look out there to see what the jobs want, and set up your portfolio to what's out there. I actually had a job that I loved. I loved it so much. When I first started, I said, this is it. This is what I want. And it was vague. It just said health informatics specialist. But everything that it said, what you're responsible for, your qualifications, job summary, I'm like, I want to do this. I want to do this. So that made me more hungry for my master's, because after I finished my graduate certificate, I pulled this in the beginning, this job application, and I wrote, "You got this." I'm going to cover the name of the company, but I wrote, "You got this." So that was my go-to, like,
that was your goal. I love that.
Yeah. So it's like a vision board, and I kept looking, I'm like, what is necessary for me to obtain this? And it wasn't enough for me to get a cert.
Yeah.
It wasn't enough. Even though I already had a job, I see what the demand is. I see what the need is. And by getting a master's, it gives you the opportunity to really dive in and utilize your skills, because we already have a skill set from being therapists.
Yeah.
And just because the demands on us is so intense, don't think that you're not you're underutilized for what your abilities are. You have no idea how much you have to offer. You have no idea until you step into it and say, wow, I did feel worthless at this place. They don't make me feel like I'm I'm contributing. I'm always like, you know, I feel like being like I'm run over, you know. I remember I had no life in me, you know. Now I'm like, I'm happy, you know what I
You're
mean?
so pumped. I was telling her offline, she's like glowing. You know, she just you get so pumped, which is awesome.
Yeah,
And you're really pumped about helping others with this,
yeah.
which I think is
Because
really
I've
amazing too.
been there. I've been there. I've struggled. I've had nights where I cried like, why is this happening? My bones hurts, you know, I'm hurting. I can't do this. And like my first year I had a back injury. I had surgery, L4, L5 disc herniation, bam, down for a year. I did 6 years and 5 years at Juville in Western New York. And next thing you know, I lost a year. And what did I do? I fought my surgery, wore a brace, rehab after. I went to Switzerland right after September 11th, and I opened up my own ergonomics business with another, a partner that I met at some kind of Myrtle Beach, South Carolina ergonomics program. She said, do you want to go to Geneva? And I said, yeah, for a job, sure. Because I wasn't working at that point. I just had surgery and I finished. I couldn't go back to work with peds anymore because a lot of bending and lifting. And next thing I know, I had a full trip to Geneva, Switzerland. And I was running starting my own ergonomics department, and we were doing retrofitting all the banks and students' desks. And we had all these contracts, and we were working with, you know, diplomats. And, you know, don't limit yourself because of your degree. I mean, I did that without my health informatics.
You just try, just do it. I have an interesting question for you, Patti.
Okay.
So this sounds a little bit like a master's in public health, and we get like a lot of questions about masters in public health. Did you at all think, what about that route?
I don't know what the definition or degree of public health entails, so I can't even begin to answer that question. I don't know. Maybe if you tell me more about it, I can say yay or nay.
Well, it's, you know, master's in public health. Let me pull it up. I mean, it's pretty broad too. I actually think the earning potential that you're talking about, and honestly, I'm not familiar with healthcare informatics. What you're saying right now is like the most I really know about healthcare informatics. I haven't had time to really look into it. I think, you know, the earning potential with a master's in public health is pretty broad too, but I think, you know, 140, 150, that seems a bit high for masters in public health. Healthcare. So here's some things you can do with an MPH, healthcare administrators, but that they make is about 100K, they're saying. Social community service managers, counselors.
Okay.
Interesting. It actually seems like, honestly, if people have been thinking about masters in public health, I would almost deter you and start to think about informatics instead. Because, I mean, I think MPH too is almost so overused, like masters in public health. So many people get it. I knew a friend and she got it and she was doing something similar. She was doing like statistics for, it was just sort of like, you know, socioeconomic statistics in the healthcare field. And so that sounds a little bit similar to informatics. She was more research based, but I'm just thinking, interesting. Honestly, people, if you've thought about MPH, I would maybe go in informatics because you make more in informatics. That's what it's looking like.
You know, money always isn't great. You have to find your love. So just remember that. Sometimes it's tough to make that decision, you know, just like the Greatest Showman movie. It's like, oh. I just heard a couple of the songs today. I was like, oh, but yeah, you know, find what you love and just know you. Yeah. Sometimes just knowing you is tough because it's not always what you want to know or what you love. And the scary part is you might go down deep enough and keep asking the question, why, to the point where you're in tears, because then you realize, oh my God, I went to school. I have a master's or a doctorate in therapy or, you know, PTA or COTA. And here I am. Like, did I waste my time? Never. Don't ever think you waste your time. You will always be one step ahead of somebody who does not have that degree. And they don't accept anybody just to go to school. You still have to prove who you are. And you've worked, you have all this initiative and what you've done in your job that you can carry over to another field. So
yes, 100%. That's, you know, that's what I say. I was just talking about sales in a video right before, and everything that I do, you know, I do a lot of like business stuff for other companies. And honestly, I could never do that without the skills as a PT. So I sometimes get frustrated that I chose to be a PT, or at least when I was younger, I got frustrated. But then I realized that me being a PT has enabled me to help create alternative healthcare careers, has enabled me to be a business coach, has enabled me to do ergonomics and all these things that if I didn't have that, I really would have no legs to stand on. And so I think, never regret your degree, because you can use it. Like, you could be a consultant, and so many times, like our skills are going to be more and more valuable for EMR companies, for telehealth companies.
Artificial intelligence.
Big
time. Actually, I had a company contact me because I ended up going on their website. And next thing I know, it was like 10 p.m. yesterday, and I ended up getting a message on my cell phone as an automatic message, and it said, "Hi, this is so-and-so. Are you ready for your interview?" I said, "Yes." Bam, questions started going. It waited for me. It's smart intelligence. It waited for me. You answer, ask the next question, waited for me. And then, because it was linked to the computer. So just think, as a therapist, all the adaptive equipment and all the things that were like, oh my God, this is such a pain. I hate when this happens. Think of every problem being an opportunity. Never look at it negative. Always be positive and use that opportunity, because you might have an idea that somebody else can use, because you are struggling. You have a problem and you're struggling to make it work. And that's actually an opportunity for you, opportunity for anybody, you know, whether they're in therapy or, you know, sports adaptation.
It kills me when I see, I bought this mirror trainer, not the mirror, but it's a knockoff. I bought the cheap one, a knockoff called Carbon. And mirror's way too expensive. And it's a knockoff. It's like made in China or something like that.
Cool. Still gets the job done though.
Exactly. But like, I'm thinking to myself, why aren't more therapists and other healthcare professionals doing this? Like, you have ideas, you have skills, take the reins and take charge. And so, you know,
there's a lot of tech companies out there, they're looking for ideas. So
exactly. But as we close,
sell your idea, get on that team and sell it, and go nationwide, go international wide, just keep it local level. You always got to keep thinking up here, and then eventually you might fall.
Yes, exactly. Try this, and if you land here, well.
Always aim high, you know, like when you negotiate money, you always want to aim high, and then
well, thank you so much, Patti, for being on here. I'm super pumped about healthcare informatics. Everyone, if you are live or on the replay, if you could give Patti some hearts, give her some lovely comments for spending her time with us today. We really appreciate all the hard work you do in our group, on LinkedIn and in the community for this. And we appreciate your time today. Thank you so much. It's been a blast.
Thank you for having me, and good luck, everyone.
Bye, everyone.
Bye.